Yeah, I mean, we haven't had the really serious COVID news for quite some time, and we actually have some. So there's a new strain. It's most mutated strain until recently reported. It's called now BA 3.2. The common name for it is cicada. I guess I don't know why they give the name of insect to the virus, but whatever. So the same symptoms, it doesn't seem to be more severe, but it's more infectious. And there's a significant concern that it's going to evade the immunity, that it's going to evade vaccinations from the last year. So that means we're probably going to see a summer spike. That's what my predictions are based on this, because the last year we had exactly the same story. I forgot exact number for the strain from last year. I mean, it was Omicron, but it was a sub version of Omicron in summer of 2025. So this one is a kind of a weird um, child of a bunch of different strains. So I think it's still an Omicron variant, but it's expected that it's going to have other features. Now, in terms of clinical, as I said, it's not going to be more severe. So I don't think that we need to worry about more serious illness, but I think concern for a summer spread is going to be real. That's my prediction, as I already mentioned, for those of you who are arriving later. You don't really need to do anything special for this strain, in part because, as I said, I don't think there's any reason to try to get vaccinated. If the vaccine works against it, that's great, but we don't yet know. And I think there's a good chance it won't work because how many mutation this virus accumulated. So that's the only COVID update. It actually is still, the numbers are still pretty low. So we don't actually see quite a lot of the COVID, but we do see this virus in US, this particular strain that I posted, and it's rapidly gaining frequency. So it's currently tested 20 to 30% of all the cases, depending on where you are in the US. So that's COVID updates. And then I have a really interesting update on the topic that's always kind of interestingly back and forth. So you may have heard that coffee and tea is good for you, and you may have heard that coffee and tea is good for a number of cognitive concerns. The data that it's helpful with Parkinson has been around for quite a long time. And now there's a really strong data that up to 20% of all dementia can be prevented by drinking coffee and tea. And what's really interesting is we've had studies like this done before, but they use different design. I think the strength of this study, first of all, it's over 100,000 people who were closely
Greetings, my
followed. That's one. And second, it's even more interesting is that they actually looked into the dosing effect. This is probably the most important aspect here. So the dosing effect of caffeinated beverages seems to be quite important. If you drink 1 cup of coffee, the decrease in the risk of Alzheimer's is very minimal. But once you start getting to 2, 3 cups, or if you drink 1 or 2 cups of tea. So it looks like tea is a little bit stronger than a coffee, which makes sense. Tea has more antioxidants. Interestingly, in this study, they did look into green versus black, and they didn't see the difference. In some other studies, the green tea was suggested to be stronger. So, how do you interpret all this? Okay, well, if you're concerned about dementia, drink 2 to 3 cups of coffee a day if you tolerate it well. If you don't like coffee, that's fine. Drink at least 2 cups of tea per day. Which tea and coffee, it really doesn't matter, but it has to be caffeinated. So decaf doesn't work. Decaf does not prevent Alzheimer's, does not decrease risk of dementia. So is it caffeine only? No, I'm sure it's not. I'm sure it's a combination of caffeine stimulation with antioxidants, with those dark molecules that represent the color. So those are the molecules, the tannins and other antioxidants that are actually probably sequestering some of the free radicals that are decreasing risk of gradual neuroinflammation. Practical applications, as I mentioned, I only gonna add one point. Try to drink tea and coffee organic. No, it's not herbal tea. Herbal tea will not do that. It has to be the black or green tea. Why? Caffeine needs to be combined with antioxidants. That seems to be the data. So the herbal teas are great for other reasons, but they're not going to, unless you're drinking herbal teas that are specifically designed to boost cognition, bacopa, ashwagandha, and turmeric and other things. But if you're just drinking tea for taste of it, then no. Good question. And oh, and let me give you a link to the study. So if you want to take a look, this is also published in JAMA. So this is probably one of the best and largest studies of this magnitude. So I'm definitely going to dissect this study in an upcoming couple of weeks on the YouTube channel. I'll geek out and I'll look into exact data. As you know, devil is in details. So we'll try to figure out exactly where the thing is. My prediction is that the best dosing for caffeinated beverages is somewhere between 3 to 5 cups a day. That is synthesis of all the information that I know. Now, that may be a little too much for some people, right? So if that's the case, what I typically do, I wouldn't drink 5 cups of coffee a day, but I would drink somewhere between 1 to 3, depending on just how it feels. And then I would drink at least 2 cups of tea a day on top. So that's my routine regimen. You don't like coffee, that's fine. Drink tea at least 3 times a day. That's what I would do. Okay, couple of minutes for questions before we pass on to Paymon to talk about integrative approaches to cancer. Yeah, reminder about Fred. Do check out the YouTube. The best is to subscribe. If you subscribe, you automatically get updates. So every time something new comes up, it just pops up in your YouTube, whatever that's called, YouTube. Well, I don't think we call it, I don't know, scroll. We don't call it scroll, whatever we call it. I don't know. In YouTube windows. Does the time matter according to the study? Not at all. Makes no difference whatsoever. Seems like it doesn't matter when you consume when you consume them. Now, obviously, you don't want to consume caffeine very late at night for obvious reason. So, you know, you do have to be careful. Now, it's Mark brings up a good point. So, will this present some negative impact on the system? Potentially. I mean, I'd say definitely if you start drinking 5 cups of coffee, you can have a problem. Interestingly, with tea, it's not directly caffeine. Tea has caffeine-like molecules that metabolize somewhat differently. A lot of people think that the tea disrupts the sleep a lot less than coffee. And tea almost never gives people jitters, like the coffee does. So, do kind of combine, I would say. Does it have to be black coffee or tea? Um, yeah, I don't think that they looked into that. I think the point is that they simply just looked. I don't even know if they assessed this. I think they just looked at the tea and coffee. I don't know if they asked what are you drinking it with. So good question. I wonder about instant. Yeah, I actually it's a good point. So I don't that's what I'm saying, Mark. I think I'll geek out on the study. I'll read exactly how they assessed it because obviously the devil is in details. They may not have asked some of these questions. They had a very large database. There's 130,000 health professionals who completed dietary intake assessments every 2 to 4 years. And by the way, this was collected for like long time. So the strength of this study is that over 100,000 people were assessed for a very long time. This wasn't, oh, let's look at 6 months and make some kind of no. They tracked these people for, if I'm not mistaken, for way over 10 years. I'll tell you in a second. I can't remember it. They followed them up to 43 years of follow-up. 40 up to 43 years of follow-up. Median follow-up was 36 years. So this is one of the best available nutritional studies of this kind of magnitude because of how long and how big the study was. That's why it ended up in JAMA, because I think this is the most important evidence we have. Yeah, and I just want to reiterate what Linda said. I already said that, so I'm repeating myself. The teas and coffee must be organic. There's no choice. You must consume those organic. This is some of the heaviest polluted foods. They're much worse than Dirty Dozen and Clean 15, typically because those things are the teas and coffee are in a way the toxins are often concentrated there just by the way how it's collected and how it's sprayed. They're not washed. Neither tea leaves or the coffee beans are washed. Even if they somehow would try to clean them, it's not really clear how you would do that. So definitely try to get organic every time. Don't buy and interestingly, it used to be that the cheap coffee was quite a big difference in price. Not anymore. I mean, you can get high quality coffee that's not way more expensive than a cheap coffee. So this is one place where I think everybody should actually spend a little bit more money. Quality tea and coffee. Okay, I think I rather yield exactly 15 minutes, even a little bit more, closer to 20 minutes to Paymon, unless you guys still have questions. Yeah, correct. So, okay. So it's my pleasure to introduce Paymon. Paymon is one of our naturopaths. He's specializing in oncology. As he starts talking, I am going to post a video that he and I did some time ago on YouTube. So if you want more details about his work, by all means, check it out. Paymon, thanks so much for being here with us today.
Thank you, Dr. Kogan. Hi, everyone. My name is Paymon Sadrolsadot, and very happy to have this opportunity to discuss about basically integrative oncology, more specifically naturopathic integrative oncology, as I'm a naturopathic doctor by license and also by education. I'm also a medical doctor. Um, with regards to the practice, what we do, this is probably one thing that all patients would like to know. What is this practice about? So, majority of times when patients have a diagnosis, like after the diagnosis, that's the time they search for basically options or alternative options to help, or sometimes adjunct options for the basically their condition. And usually patients, when they come to us, they have a confirmed diagnosis. There is a smaller percentage of patients who are interested in discovering about potentials for abnormal cells and potential for cancer, especially if there has been some cancers in the family and they are more concerned about that. So this is like smaller portion, which we can do like kind of general testing, sometimes genetic testing to see the potential, the kind of predisposition. But the reality is majority of our patients are after the confirmed diagnosis. And I should say probably patients that I see, 90 to 95% are at some point with their conventional treatments, and they have either already started the treatment or they are planning to do so. And there's a very small percentage, probably I have about 5 to 10% of patients who say we don't want to go for that route, and just whatever you can do with natural stuff, that is our plan. And I will basically support whatever the patient's decision is. So what we do, basically our first intake is usually a more thorough, usually 90 minutes intake where we go over the foundation, what I call basically like diet and lifestyle. So that's the base that we start. There's a lengthy, I should say, intake form that we have. Like we would like to know from every angle, from what is your diet, what is your basically supplements that you take, your medication that you are on, the lifestyle, how much you are physically active or not. So that's a basically intake form that before the visit patients upload, and I go over them in detail, and then in the visit I discuss and see if there is anything that I can basically improve with, especially regards to diet and lifestyle, which usually we find areas very much about diet. And I quite frequently see right after the diagnosis, patients start radical decisions about diet. They start fasting, water fasting, And it's very interesting, like the time that body needs a lot of support, like the plan is chemotherapy, and there are sessions scheduled, and at very specific time that the immune system should be robust and support the body with fight of the cancer. Sometimes see radical decisions about water fasting 21 days, or like just cutting significantly on diet, especially the calorie. So we will discuss what is the clean diet, and that is what we would like to see, but definitely calorie intake. That is on our radar. We don't want to see weight loss happens because the procedures, the treatments, they have a lot of basically pressure and load on the body. And if at the same time patients decide to do very radical diets that may not be supportive, it may just like have a negative impact. So, and I understand like certain conditions, let's say prior to chemotherapy, there are certain days that the patient want to do the fasting. By research, this has been shown that the effect of the chemotherapy on the cancer cells, like how much these bad cells are more sensitized after, like during the time of fasting. This is like supported by evidence. So I understand that, I can discuss that. But if there are radical decisions, I kind of try to highlight that. Always we talk about clean diet as much as possible, like sugar, processed food to be cut, and then like the veggies, proper hydration. So these are the areas that we talk about diet, and then lifestyle, like basically physical activity. If there is any exposure at home, let's say if there is mold, if there has been cases of basically water damage, and let's say there has been some history of mold growth in the house, and also candida infection in the body. These are things that we will discuss. Level of physical activity. So this all goes to basically foundation, what I call foundation. Next part is basically testing and learning about if there is any deficiency, especially with regards to vitamins, minerals, amino acid, or sometimes toxicities like heavy metal toxicities that quite frequently we see: mercury, lead, arsenic, cadmium. So they're basically heavy metals that can be the cause of the health issue. So we can test them, and that will be on top of the regular LabCorp testing. So we call them specialty testing. You might have heard about NutriVal, or like basically GI effects. So more understanding about the body. And these tests are really detailed, like 13, 14-page report about the body. And we try to, first of all, make sure if there's any deficiency, we kind of address that. And then if things still are within the range, the question would be, what is an optimum number? Talking about vitamin D, such a common, basically vitamin, we check the serum levels. So the range is really wide from 30 to 100. And interesting thing is quite frequently what we see for our patients is that their level of vitamin D is deficient, like even less than 30. But even like, let's say if the number is 31, from a medical perspective, your doctor may say you're not deficient, so your levels are good. But the question is, what would be a better number, an optimum number for vitamin D, especially when it comes to cancer discussion? So this is type of things we want to make sure that we are at the optimum level. And again, like there's no limit how much we can test. So we would like to get a proper amount of information about the body, and especially like deficiencies are things that are on our radar, and we should address them. So this is about testing, and with testing, again, sometimes or probably a lot of times I do tumor markers, and the tumor markers, like again, like all my patients, when they come to me, they have already a confirmed diagnosis. It's not for the diagnosis, it's just for follow-up and monitoring, and especially with regards to the treatment, the way that the regular follow-up scans and imaging has been usually is done. I also follow up that with the serum tumor markers, inflammatory markers. So this is another thing we check. And basically, I should say the aim of our practice is to support the patient's body for the procedures that they are going through. So is it like preparing for a surgery? Is it like 8 sessions or 8 rounds of chemotherapy? And kind of to make sure that body can handle these treatments properly. So this is like usually active phase of treatment. And again, like with chemotherapy, like more traditional ways of chemotherapy, there are basically a lot of load on the body in terms of feeling tired. The neuropathy can happen, feeling nauseous during the time of infusion. So these are very common symptoms. And the practice of integrative naturopathy at this phase will aim for supporting or minimizing these basically side effects. So the practice of integrative naturopathy is basically at any phase of treatment, it will be different. That's what I'm trying to highlight. So the time of active treatments, there's a preparation, if it's a surgery, and the dose of medication, the supplements, they should be all checked. And very important thing about the supplements that we prescribe is we do interaction check here. So it's not just randomly saying this is good for that condition. You can buy it like when you go online. There are so many things that are good for everything. And again, our patients are on medication. Sometimes they are on medication from before, and definitely for the let's say chemotherapy medications that they are offered. So it would be important to say what we prescribe is in a harmony with your medication. So there's no or there's minimum interaction. And if there's interaction, it's still how we can kind of move these medication time to make the effect maximum, like the side effect minimum and then the effect maximum. So this is another area that I should highlight. Is not like our practice is as much as possible evidence-based. So if you go over online and kind of listen to discussions and people's experience, there might be successful experiences, but the question is that supported also by evidence, right? So the focus is the practices that number one are in harmony with the conventional treatment, and number two, there is this reason, there is evidence that we can show to our patients and share that with patients. And when the active phase is done, sometimes it can be a couple of months, it can be longer, a year. Then the supplements that we prescribe will basically when let's say the doctor says to patient that okay, you are okay, you should wait until next round of imaging, the PET scan that we do. For now, you don't need to do anything. That's actually the time we can do a lot of basically support with the supplements. So supplements, there are categories that are good for general health. And then there are certain supplements that they have been found to have an effect on the bad cell or cancer cell growth. So when we talk about like curcumin, for example, when we talk about the fish oil, when we talk about like melatonin, when we talk about medicinal mushrooms, there is a kind of benefit in terms of how they can slow down the reproduction of the bad cells, or even in certain cases, the research has shown that they can stop the growth of bad cells. So there is a phase that when the basically medical treatment is almost done, that is a good time that our practice can continue, can maintain the good results, and hopefully the cancer, the bad cells do not come back, or the growth doesn't happen, regrowth doesn't happen. And this phase, like if you say in alternative integrative oncology world, if you say the top two modality that there has been more evidence and more research about, probably you have heard about high dose IV vitamin C infusion, which is basically through the intravenous. So it's not oral. This is like a confusion sometimes happens. This is a high dose. And when we say high dose, it's really high dose. Like when you take a capsule of vitamin C, it's usually like 500 milligram, like half a gram. And what we here talk about is like 20 grams, 30 grams, 50 grams, 75 grams of high dose vitamin C. So this is one thing that is one area that the discussion is during the time of infusion. By the time that this high dose vitamin C flushes out of the body through the kidneys, there is an uncomfortable situation for the bad cells happening. So there's a high level of basically oxidative stress that these bad cells, ideally during this phase of 45 minutes to 1 hour, that this flushes out of the body, these bad cells die. So if you say the mechanism is somehow similar to chemotherapy, in a way, yes, because chemotherapy also makes a situation that the bad cells cannot grow. But here it's all about like a natural infusion. It's just like vitamin C, like we are benefiting from vitamin C from a different perspective. It's not meant specifically as a supplementation. It's just like the phase that the vitamin C is infused to the body, and the high level of hydrogen peroxide is produced in the body, and cells will suffer, like bad cells. Like every single cell will suffer, but mostly cells that have a least genetic stability, which are cancer cells. So again, we have to check certain enzymes. We should make sure that the kidney function test is just normal, so that body can handle the high dose vitamin C. So there are certain tests done prior to that. The other modality, the other kind of approach that you might have heard about, and again, like there's a ton of evidence for, is the mistletoe injection or mistletoe infusion. And what is mistletoe? Is an herb which the way that it works is kind of different from vitamin C. So the mistletoe, when it is injected to the body, like done subcutaneously, usually done at home. So there's a training session that we teach the patient how to do it, but then just like insulin injection, patient continues the treatments at home. So what happens when basically injection happens, mistletoe stimulate the immune system. And it's just like saying immune system, hey, wake up, you need to be more active, you need to be more basically functioning at this time. So this is like how when we do the injection, usually get a skin reaction at the site of injection. That is kind of telling us the body immune system response. Sometimes the reaction is too much. We say, okay, the dose is good enough, we need to reduce it. Or sometimes there's no reaction. That's how we increase the dose. So the mistletoe injection / infusion, which can be done either of them, is basically stimulating the immune system and asking immune system to ideally the natural killer cells, the cells that are responsible for fighting with the bad cells, to be more active. And there are a ton of evidence with regards to the mistletoe. Actually, about 3 years ago, Johns Hopkins Hospital, they completed phase 1 research. If you search Johns Hopkins mistletoe study, you will see that research, the results were published, and was basically promising still. There should be phase 2, phase 3 to complete, to be approved by FDA. But in Europe, this is very well-known approach, like actually in Germany, in Switzerland, oncologists, right after diagnosis, they start the mistletoe. Concerns about the mistletoe is the medication that the patient may be on. So there's a category of medication. Basically, they are targeted therapy and basically immune therapy. So sometimes, because the mechanism of action is similar, especially with immunotherapy category, we need to know what is the exact name of the medication and kind of see if we can do the mistletoe with that or not. So this is one thing. Then the other thing is, if a patient has already some levels of autoimmune diseases. So if immune system is already in a hyperactive state, we don't want to stimulate it further. So there are certain things that we have to check to make sure that mistletoe is a proper action. But imagine like with traditional chemotherapy, just the right after diagnosis on through the sessions of chemotherapy, like the infusions of the chemotherapy. This is a very well controlled and kind of tolerated by the patient, and a very good adjunct, I should say, to the treatment. And again, like there are other approaches that certain conditions that If they are proper, we will discuss it. Probably repurposed drugs category as another category, and um, basically cannabis is the other category. So there are many different approaches which we will discuss and see what is the best to offer to patients. So I try to be exactly on 20 minutes time. If there is any question, please.
Let's take 2, 3 minutes for questions before we hand it over to Catherine for MindBody. Okay, so there's some questions in the chat. Paymon, do you want to just
Yes, I can
respond?
see that.
Mhm.
Yeah, so the new blood test by Signatera using ctDNA for monitoring cancer. Yes, and if so, any thoughts? This is a great one. This is usually done by the oncologist, like the when there is a sample and the tissue sample, and they kind of find the tumor cells, and especially with regards to the recurrence, this is definitely, but this is like after the diagnosis and more for monitoring. I don't order it again, like oncologists usually order it, but it's a great test based on the basically genetic information of the bad cells. If they can see that again in the body, thinking about like recurrence or how well treatment is basically responding. How do you use chelation, if at all, in treatments? So if there is heavy metal toxicity that is confirmed, probably usually mercury, so there are phases that we can go with, and basically supplements that can do the chelation. There is like different ways to send the toxins out, but also at the same time support the liver. And if again, like usually I limit it to supplement, but there are also IV treatments for chelation. I don't do that because sometimes IV chelation can be heavy on body, and at the same time that the heavy metals are removed out of the body, but also iron, copper, good minerals also removed from the body. So again, like it might be a treatment with cancer. It can be a discussion outside of the oncology, but probably quite frequently with mercury, we see that especially people who eat a lot of fish and like canned fish, or they have a number of fillings like amalgam filling. This is what we see, and we do the proper treatment when such is discovered.
I think let's do the Mark's question last. Mark, I think you meant to say glutamine, not glutamate as the food source, I'm presuming. But anyway, I'll let Paymon. It's a good question by the keto.
So comment on the keto diet in cancer. Um, yes, and keto diet, especially if there is a like let's say the patient has extra weight, and basically we would like to cut weight in a proper way. The basically keto diet is a proper one. Uh, it all depends which phase of treatment the patient is, right? When it comes to chemotherapy, I prefer to go with clean diet rather than any other basically types of diet, like more Mediterranean, but just to make sure that as much as possible we are providing basically food sources of antioxidant, but also cutting out anything that is process like sugar. Probably that is the big one, the number one thing to discuss. So making a clean diet, that will be my priority in my approach, but I understand that ketogenic diet, especially if there's a plan for cutting weight and losing weight, coming to more proper BMI, so that will be a proper approach.
Great. Well, thank you so much. I see there's more questions coming, but I think we're out of time. So what I would propose you guys table the questions. We'll see if we have time at the end. If we do, we'll try to answer it. Catherine, thanks so much for being with us. Everybody know you're ready. You've been on this meeting multiple times. Catherine is one of our Reiki practitioners. She also does lots of other things. So what are we doing today?
Uh, can can everyone hear me okay?
It's a little soft. Can you
Soft?
say something?
Okay. How about now?
Yeah, that's better.
Okay, there we go. Sorry. Zoom always changes my speaker settings anytime I log on. So, and not a problem about the timing. That was a really fascinating conversation. So today, I just figure with everything going on in the world, it's a perfect time to do a relaxation meditation. Um, just giving us some time to breathe, bring a little more calmness into our mind, body, and spirit. So, um, as we begin, I invite you all to prepare yourself for our time together. So, if you want to change your seat, um, if you need to do any gentle stretches, movements for your body, you can. If you want to keep your video on, you can keep it on. If you want to turn it off, you can turn it off. Whatever feels best and right for you. But invite yourself to prepare to experience calm, to experience a little bit of quiet, and to know peace this Friday afternoon. So, finding that comfortable position. If you need any blankets or pillows to get even just 1% more comfortable, I invite you to do that as well. And wherever you find yourself, I invite you to begin to sink down and be supported by your surrounding environment. You can close your eyes or hold a soft gaze forward, whichever feels most comfortable for you. And turn your attention and awareness to your breath, breathing naturally. Inhale, fill yourself with life-giving air. Exhale, allow yourself to relax a little more, allowing your body to sink. Breathing in that life-giving air, breathing out as you relax. Breathing in, breathing out. Breathing in, breathing out. Begin to withdraw your thoughts from your surroundings. Center your focus inward on the peace, on the stillness within you. Prepare yourself with an attitude of passive attention, alert yet quiet, aware yet at peace. Making nothing happen, allow yourself to let go of any tension, controlling anything. Watch as relaxation spreads to all parts of your being, physically, emotionally, mentally, all of who you are. Continuing to breathe in easily and breathe out naturally. Breathe in, breathe out. As you focus on your breathing, that breathing in and breathing out. As you breathe in, I invite you to say to yourself, I am. And as you breathe out, saying to yourself, relaxed. I am relaxed. I am relaxed. I am relaxed. I am calm. I am comfortable. I am relaxed. I am relaxing into all the supports around and beneath me. My mind is quiet. My whole body is relaxed. I am at peace. I notice my quiet. I notice my peace. I notice my calm. As you continue to breathe in and out, I invite you to draw your attention and awareness to your right hand. Allow your right hand to become heavy as you breathe. My right hand is becoming heavy. My right hand is heavy and relaxed. Allow the heaviness of right hand to spread up the arm. Right arm becomes heavy with my breathing. My right arm is heavy and relaxed. My right hand and arm are heavy and relaxed. Turn your attention and awareness now to your left hand. Allow left hand to become heavy as you breathe. My left hand is becoming heavy. Left hand is heavy and relaxed. Allow the heaviness of the left hand to spread up the left arm. My left arm becomes heavy with my breathing. My left arm is heavy and relaxed. My left hand and arm are heavy and relaxed. Both of my hands and arms are relaxed and heavy with my breathing. My hands and arms are heavy. My hands and arms are heavy and relaxed. I continue to breathe deeply and rhythmically. I allow the heaviness of my hands and arms to spread down my back to my right leg and foot. I feel the weight of my body. My hands are warm and heavy. My back is relaxed. My legs and feet are becoming heavy. My right leg and foot become heavy with my breathing. My right leg and foot are heavy and relaxed. My right leg and foot are heavy and relaxed. I allow the heaviness of my right leg and foot to spread across my hips and down my left leg and left foot. My left leg and foot are heavy and relaxed. I allow my left leg and foot to become heavy with my breathing. My left leg and foot are heavy and relaxed. My legs are heavy and relaxed. My arms are heavy and relaxed. My feet are relaxed. My hands are relaxed. I am comfortable. I am quiet. I am at ease. My body is in tune with my mind and connected with my breathing. I am heavy. I am relaxed. I am quiet. I feel energy flowing through my arms to my hands, through my legs to my feet. I am alive. I am refreshed. I am relaxed. I feel a freshness of spirit. Continue to breathe in and out for the next minute or so, repeating these words to yourself. I am alive. I am refreshed. I am relaxed. I feel a freshness of spirit. I invite you to take a deep breath in now. Exhale through your mouth. A deep sigh. As it feels comfortable for you, you can begin to gently stretch, make subtle movements, or anything that your body is calling for at this time, but remain relaxed. Remain relaxed and refreshed as you prepare yourself to return to your world, to the outside. Refreshed now, renewed now, relaxed now. Slowly begin to open your eyes, becoming aware of your outside surroundings, but preparing to move on with a calm energy, a refreshed, renewed, relaxed energy. Taking these feelings with you as you move on with your day. And as you need to, making any other movement, stretches, or adjustments as we come back together. But thank you so much for participating in this exercise with me, getting a little more breath in, hopefully a little more calm and relaxation. It is always a pleasure to work with you all.
Okay, Catherine, this was delightful. I think I'm barely can speak. I think I need to go take a nap. This is wonderful. Well, thank you so much, everybody, for coming. We are going to answer some of these questions later, so hold them till next week. If you're my patient and you have something specific for me, stay here. We'll have our time. And next week we're gonna have a Chris Palmer has been with us multiple times. He's he's gonna talk. I don't know what he's gonna talk about, but he wrote this wonderful book on a good death. Highly recommend it to everybody. And I'm sure he's going to talk about something along the line of that. And also looks like we're going to have Ilana Rubin from Kindred Nature. I think we already had Ilana with us before as well. Everybody have a wonderful weekend. Enjoy the spring or lack of such. I hate the fact that we never have spring. It's like it goes from winter to summer and there's no spring. But anyway, whatever it is, it's a spring. So we'll see you next week. Thank you so much. Paymon, Catherine, you guys, thank you so much.